So basically, a breast lift is for somebody who has lost volume in the breast and they've sort of deflated, and they're sort of sagged and so on. And most patients who need a breast lift know that they need a breast lift. They sort of, in their mind, in their heart of hearts, they know that they could use a breast lift. And what we do when we see patients for breast surgery is we measure the breast. How far is the nipple from the notch in your sternum up in your neck, and it also depends on where does the breast sit on your chest. And we talk about the footprint of the breast, and that is where does the breast sit on your chest? Does it sit high? Does it sit low, medium? And what is the relationship between the nipple and the crease under the breast, and so on. So there are a lot of measurements and evaluations that we do before we recommend a breast lift. When you do a breast lift, there are different kinds of breast lifts. Sometimes you can make do with just removing a little skin around the areola. Sometimes you need to remove a wedge of skin in the vertical orientation, and sometimes you need to have the anchor type of breast lift. It depends on how much extra skin there is, how big the patient wants to be after surgery, and what size implant are you planning to use. With breast lifts, we are actually making the skin envelope smaller, so there's a limit to how big an implant we can use so we can safely close the skin around that. So I don't like to do breast lifts with large implants. I tell patients you can have, a smaller implant, and then when everything's healed, you can go in and put a larger implant in if you wish. But a large implant increases the risk of complications when you're doing a breast lift. And then the question is, do I have to have an implant? No, you don't have to have an implant. But you should know that when you do a breast lift, because you are decreasing the size of the breast envelope, of the skin envelope of the breast will be smaller. So I tell people you will lose at least a bra size if you do a breast lift without an implant. Now, sometimes you can do a breast lift and do some liposuction and use some fat transfer and to make the breast fuller. But a fat is not really a substitute for an implant. It can help shape the breast, but it doesn't take the place of an implant in terms of making the breast larger. Okay. So that's sort of the breast lift overview. Yes, you can have just a breast lift, and if you have plenty of breast tissue, maybe that's all you need. Most patients want a small implant. I caution people not to want too large an implant. And, the decision about the lift, do you need one? What kind do you need? Depends on the shape of the breast and the measurements of the breast. And really, really, for patients who go to multiple consultations, if they, if 3 of the consultations say you need a lift and the 4th one says, nah, you don't need a lift, listen to the 3 that told you that you needed a lift. You probably do need a lift.
Okay.
But you can always find somebody to put an implant in. And I see those patients too, and they come back a year later and say, I hate the way I look. I realize I needed a lift.